Right. Hello, and welcome to Good Government Illinois' virtual town hall with Congresswoman Robin Kelly. We're also joined by Zach Ostro, the Congresswoman's legislative director. Thank you so much to Congresswoman Kelly and her whole team for making this happen and for their time tonight. I'm Morgan Harris with Good Government Illinois, and I'm just going to go over a couple of quick housekeeping items before we get started. First, about the Zoom link. Everyone is automatically muted to minimize background noise. But on the bottom left of your screen, you'll see a little video camera icon, so you can turn on and off your video if you'd like. In the center bottom of your screen is the chat box. You can use this to ask questions during the town hall. And we know that we have a lot of questions that were already submitted when people registered. We're going to do our best in the limited time that we have available to get to everything. If your internet connection gets interrupted and you drop off the Zoom, just click the link in your email again and we'll get you right back in. The hashtag for tonight's virtual town hall is hashtag GoodGovIL, and we will be live tweeting the event on Twitter at our handle at GoodGovIllinois. Finally, make sure you're signed up for our email list to hear about future events, and you can do that at our website at www.goodgovernmentillinois.com. And now I'll turn it over to Good Government Illinois' David Orr.
Welcome, everyone. Thank you, Morgan. Welcome, Robin.
Thank you.
Welcome, Zach. Before I introduce you, Robin, I just want to mention briefly that, a lot of questions have been submitted, as Morgan mentioned. We'll try and lump some together. So some of the things we'll talk about particularly include the stimulus, kind of where the money's going. We'll try and touch a little bit on how much of the money has gone to people it shouldn't have and the problem that's created. Talk a little bit about the really battle over the aid to the states, which is really critical for Chicago's survival in the future. So impact on Chicago and the suburbs, particularly on Black and brown citizens who've suffered so much more because of the COVID-19. We'll try and get into issues like housing, and we'll try and talk about the election and many other questions. So we'll see where we can get. We will keep it to an hour. In other words, we're going to get off at 8 o'clock. So I'll let you know that. So very briefly, because we've sent you all a more elaborate bio on Robin, but let me just mention a couple of things. If you don't know, she was first elected in 2013 in a special election. Okay, so she's been in Congress that long. Her focus has been on a lot of things, but I've just mentioned three: expanding healthcare, which of course is critical, job growth and economic development, and consumer protection. But many others, and she serves on some very powerful committees. She's also chairman of which is the House Democratic Policy Committee, which is very relevant because the House Democrats are trying to obviously make the CARE Act much more stronger. Before Congress, you may have known she was a state rep. She also served administrative positions in both local government and state government. She's a PhD in political science. You're overqualified, Robin. And finally, she's been a big help to me in Good Government Illinois. So let's get started, Robin, with more of a general question, a little bit specific, but kind of a general question. Tell us some of the key things that the stimulus package is doing, particularly for Chicago and the suburb, at least Chicago region, because you represent both.
Well, I would say one of the main things we wanted to do was help small business. The other thing we wanted to do is help in the healthcare arena, whether it was healthcare centers, hospitals, making sure equipment got to the appropriate people, and also helping individuals. And that started with the $1,200 checks and the $500 for children. And then, even though it hasn't worked as well as we hoped, the unemployment. So trying to keep individuals on their feet and small businesses on their feet, which is 50% of our economy.
Okay, then let's delve a little deeper. Let's start with this issue that keeps coming up, and it really frustrates people, all those in the small business, others that aren't getting their money. A lot of significant money has been diverted to large corporations and the wealthy. Without going to a lot of detail, there's a lot of special things done. Hedge funds somehow, because the way they did the taxes, we're getting more money that can write off, even for last year's stuff, even before COVID-19. And we've all heard about the Potbellies and the LA Lakers and all sorts of things. But we keep hearing now that the treasurer says, we're taking that money back, but they won't use it to give to needy small businesses because they don't have a mechanism to do that. What you and the Democrats, what are you trying to do to make them more accountable with the money?
Well, actually, we passed CARES 1, I'll call it, and this is an interim emergency bill to try to clean up some of the things we did or involve some of the people that we didn't involve. But actually, Treasurer Mnuchin came to us and wanted another $250 billion for small business because, as we know, they ran out of money, and we're the ones that put in, this is for small business. We had the $60 billion set aside. Our hospitals need more money, and then we got more money for testing. But also what I tell people, we don't like, everything that happened, but the problem is we can pass what we want in the House, but we can't pass what we want in the Senate, even though it's been bipartisan for the most part. But that's the thing people have to remember, that we have to get it past McConnell, and Trump has to be willing to sign it. So it is give and take, to a degree. And we did a lot more, I think, than people realize when they only knew how the bill started. But some of it is what the Republicans wanted. Now, as far as, the potbellies, that certainly was not our intention. The potbellies, the Lakers, or Ruth Chris. So I'm glad they're not accepting the money. But, when he says we're not going to use that money to give the small business, is because they will not change at this point any of the PPP rules. Like when we tried to get other people in to do things different, they won't budge on that. So we got more money, but they won't. There were some things we asked, would you do, but they would not do. And if they don't want to do it, even though we're the majority in the House, they're the majority in the Senate, and they have the president.
Yeah, I think we all hopefully understand there's an amazing political battle going on.
I mean, Nancy's been amazing. She really has.
Right. And the Democrats at least been supporting a lot of things that I think most Americans support, including aid to the hospitals, aid to local cities, more money going to average folks and smaller businesses.
Right.
So we will see what happens out. Did we just lose Robin, or you're back?
I'm back.
Okay, so, but everyone is listening. We should try and make that point everywhere we can on social media. There's no excuse for the White House saying they can't redirect that money, because we all know there's thousands of small businesses. And I mean, recently, I think the mayor focused some money in Chicago on really small businesses, like
right.
5.
The average small business in Chicago, I had the mayor speak to the Congressional Black Caucus. She gave them an update on Chicago because, of course, the idea that 72% of the people dying were African American. And so they wanted to know what she was doing, and she wanted to tell them about what Chicago was doing. And she told us that the average small business in Chicago is 5 to 7. But of course, we know with particularly Black small businesses or businesses of color, Black and brown, it could be one or two person shop.
Mentioning the mayor. The mayor is pretty new. How are she and her staff doing in working with you and others to get what we can out of Washington?
Oh, no problems at all. She has a good relationship. When she won, she came to DC, and I made sure I hosted her so other people, could meet her. And then she was my guest at the State of the Union. And, she's already well known and well respected, at least by, the Democratic caucus. She's presented to the whole caucus and the Congressional Black Caucus. So she has made her way into DC and into the hearts of many, it seems like.
Okay, let's keep on this issue now of things that seems like you and other Democrats are fighting for. We haven't been able to do. There's been some money coming to states, okay, variety of things, but we all know that states and governments are getting enormously difficult budget problems in the future. I can't remember some of the numbers offhand, but one of the studies said that $500 billion that they're going to be losing because of the virus. So I believe you all have been pushing for federal aid to localities and states, and yet the Republicans are opposed to that. Do you see any chance for that in the coming sessions?
I think it's going to happen in CARES 2, the next CARES bill. I think that that's going to happen. And what we're saying is, we're not saying we need to give to states and local government, even though we do, but we need to make sure we give to this is about teachers and firefighters and policemen and healthcare workers and, you know, the everyday workers. This is about them and the states and local government being able to help them. I work for local government, and, you know, we don't want them to have to lay off the people that make this, you know, the cities and the towns go. So I believe, you know, I'm not going to say 100%, but I'll say 99% that it'll definitely be in the next bill. And we are also going to lower how many people. Before it was 500,000 or above for the cities, but that's going to be lowered. It probably still won't be low enough to help, you know, my district, because I have Chicago, but 2/3 of my district, you know, is the South Suburbs, Will and Kankakee. And I don't think I have 43 towns, and maybe the biggest one might have 37,000, but most are under 30, under 25, even under 20. So that still won't help us, but hopefully there'll be a mechanism where we give the state of Illinois enough money where they can help with local governments, and then also be flexible in how they can spend the money. We had a conversation with the governor late afternoon, and that's one of the things that he was talking about, just more flexibility in how the money can be spent. But no, we're definitely fighting for that. And I can't believe that, I'll just say the rank and file Republicans don't want that. This is, you know, McConnell talking the craziness about bankruptcy and all of that. I mean, even Republicans attacked him for that.
Well, let's hope that you're right, because it's so important, because we don't know how long the virus will last. We know it's costing an extraordinary amount of money. And just looking at some of the numbers, we've been reading a lot of articles. And by the way, we'll put some links now and then to articles we think are really good for folks out there that want to be looking at it. I just wonder if I had those numbers handy. You know, this whole notion that somehow blue states are not paying their fair share, or they're misrepresenting money or whatever. But we do know, and I don't know if I have the numbers right here, but places like New York spend well over 100 billion. They get 100 billion and more less than they give.
Right.
They don't get as much money. Okay,
yeah, I saw Cuomo's press conference, and, you know, I'm from New York, so I think it was something. I remember the number 29 billion, and you're right that they give so much more. But it's New York. I'm sure it's New Jersey, the really high property taxing states, you know, and then the states that get back. There are blue states too, but definitely more red states that get much more. And McConnell's state is one of them, Kentucky.
Yeah, Illinois, for example, apparently the president criticized, has been given an average of 5.6 billion back. In other words, that's how much they lose in the exchange, whereas Kentucky got a boatload back that they didn't put in. So we just need to make sure people understand that is certainly not true. Let's keep on this subject. I want to ask you particularly about, we touched on the base of how this is having a greater effect on Black and brown folks in the Chicago area, all across the country. What are the kinds of things that we can do about that?
Well, I'm the chair of the Congressional Black Caucus Health Brain Trust, so I've been working on this issue for a long time. And the coronavirus, those numbers are shocking, but we tell people they're not surprising, because we know this has been the issue ever since we've been on the, came to the United States. And I've worked 3 years on the issue of maternal mortality. And even though it happens to all women, it happens to Black women 3 to 4 times the rate of white women. And in Illinois, it's 6 times the rate. And for Native women in the state of Washington, it's 8 times the rate. So, it's the same, it's the social determinants of health. You know, it's the wealth gap, the job gap, the education gap, the food insecurities, it's the, the environment, and we are at the back of the line in, so many of those areas. People keep saying, well, you have asthma more, you're obese, you have diabetes, but there's a reason why those things are happening. And to solve this problem, we have to get at those social determinants of health. So we, are taking advantage now that the virus has really put a spotlight on that. And I was a part of a team, Senator Warren, Booker, Harris, and in the House, Ayanna Pressley, who represents Boston, but she's from Chicago, Congresswoman Lee, Congresswoman Bass. We sent a letter to Secretary Azar, and we've since sent letters and met with Dr. Fauci, the CDC, but we actually got our work put into the last bill about data, because data informs, policy and legislation, and that the racial data had to be kept, but not only on deaths, but, who was positive, who was hospitalized, because that's the other issue that, and like in New York, our colleagues were saying that, people were told, but all over, not just New York, only if you have a symptom, then you come, or, and then a lot of people died at home, or people were tested, but not told what to do until they got the results of the test, like, social distance yourself, and those kind of things, but just not the same treatment as other people have got, not the same access. So it's no wonder this disease and others are hitting us more. But what we have worked on is concentrated testing or focused testing. We're pushing for mobile vans to actually go into the neighborhoods instead of expecting everyone to come to us. Everyone doesn't have a car, or they might live where there's no transportation. The rapid testing, and then, as I said, the data, and making sure that when there is a vaccine, that it goes where needed, and it goes into the communities of color. And the other thing we want with the mobile testing is going to where the essential workers are. Go to the post office, go to the stores that are still open, go to where the bus drivers are and test, go to the people, because a lot of those people are black and brown.
Well, it's probably evident to most people now that crises like this expose the underbelly, expose the racism and inequality and so forth. And actually some of the listeners, and it's a very big question, I want to talk some about how this could be changed in the future. But just to emphasize your point, if you think about, let's just take the example of the president now saying, well, he wants to have all the meat plants open, et cetera. If anybody knows anything about Tyson Foods and chicken and the way they discriminate against their workers all the time, many of these people are minority workers. They don't have much choice. They don't have sick pay. So hopefully these unfair conditions that have unfortunately been festering and getting worse under this administration can be exposed, and we can start working on those things in the future. Let me jump to one that I know you're working on too. You mentioned the post office, and then I'm going to stop very quickly and bring in some of the other questions. We want to talk about elections because we're all worried about what's going to happen. The effect, like Wisconsin, was a disgrace. I want to talk about mail voting, where the Congress is, the post office. And one thing about the post office that I just saw for the first time, that I didn't know this, that one of the reasons they have such a terrible time surviving is that Congress, I believe in '06, passed legislation that required only the post office, no other federal agency, to pay in advance for 75 years for all of their pension and health care costs. Now just think about that if you had to do that. Anyway, we know that Republicans historically have been trying to beat up the post office. Maybe it's because of the union, who knows what it may be. But what can happen there? Because we need the post office for a lot of reasons, and we need to have as much mail voting as possible, particularly in November, because we don't know exactly where we'll be with the virus.
I actually, for the past 7 years since I got to Congress, served on oversight and reform. So the post office reports to our committee. But personally, my mother retired from the post office in New York, and my brother is a current worker in New York and still working, going to work every single day during this crisis. But yeah, I'm not sure what it is with them that they want to, well, I should know they want to privatize everything. That's one thing. But we have HR 4 in place that protects voting rights. And also we will fight them tooth and nail. And the speaker already said, you know, the post office will be there, but we tried to put money in for the post office and they fought us on that. But the post office is going to survive. And my brother is the one that told me how they have to pay it forward for the pensions. And when I think about, you know, what happened with pensions in Illinois, you know, if that had to be the case, you know, anybody would be in trouble. And then some of the, like, as they explained it to me, the monies that they get, like they can't spend it on operations. It only can be spent, you know, on certain things. But the post office is not going to close. And also, you know, they deliver for Amazon, you know, they help more people than people realize. And then in the rural areas and, you know, on the weekend, and like they say, they take care of the last mile. So it would hurt a lot of people. A lot of small businesses would be hurt, you know, if something happened to the post office. And there are states already that do voting by mail. Oregon, that's all they do. And I know the president was saying, oh, it'll be a lot of fraud. And when I think about 2016, that makes me want to scream. But he says a lot of things that make me want to scream. So, yeah, it just seems like he has something against them. But before him, they've always been trying to privatize, take it to 5 days, really dismantle it, but they have not been successful yet.
Right. Unfortunately, there are some red states that rely on mail as well. In fact, Oregon, led by a very, very liberal-minded Republican years ago that led to mail voting in Oregon. So let me ask some of the listeners' questions. So a little bit, but Tariq Butt asked about how can we eradicate the disparities in the COVID-19 epidemic by providing more resources to the economically challenged neighborhoods. You kind of touched on that. Is there anything else you want to say about that, what we need to be doing?
Well, the Congressional Black Caucus, and we're working with the Tri-Caucus, the Hispanic Caucus, and the Asian American Pacific Islander Caucus. We're working together also, but we are meeting with everybody that we can meet with to let them know that we're watching and what our expectations are. We have a letter going to Vice President Pence, and we expect, you know, some answers. And this is coming from senators and House members. But really, we have to make sure that the resources are going, you know, where they need to go. Now, again, Governor Pritzker actually put together a task force that's looking at this also. So, you know, it's not just on the federal level, but different states are doing different things. And I serve on Energy and Commerce, and we are also putting together a task force because we want to make sure that, like, vaccines, resources, whatever is happening is going to where they're needed, to the areas disproportionately suffering.
Okay. Thomas Wilson asked, what is Congress doing about the massive number of deaths in nursing homes? And what is your position on HR 555, the Disability Integration Act?
Well, I'm one of the co-sponsors of that. So I support it. And it's scary when I think about the nursing homes. And one of my colleagues and I, he's also on Energy and Commerce, we were saying that we really have to take another look at nursing homes. A suggestion was that nursing homes need to have some type of infectious disease person that's connected with them, just in general. And but we were told that there's not enough of those type of folks to go around. But we haven't specifically talked about nursing homes in ENC, but that is something that will come up, because in my district, I have a nursing home that's probably one of the, I don't know if it's one of the worst, but on the south side of Chicago, but a lot of deaths. But even in the south suburbs, I just had a call from someone today that's very concerned about his mother, because he was told she was tested, then 3 different times, and then he found out that she was not tested. And they're having people at that nursing home that have coronavirus. So we haven't had a deep conversation, at least in the groups, on the committees I'm on, but I know that's coming.
Well, I'm sure, as Thomas knows, that Remember, so much of this is when you get a bad start. In other words, nursing homes, obviously more vulnerable people. A lot of those places did not get the help they needed from federal or state government, particularly federal leadership, didn't get masks in time, didn't get lots of things in time,
Mm-hmm.
and boom, it spread so quickly as we saw. Um, uh, I'm not sure about how to pronounce this, but Maba Allen asked about what is the overreaching plan to bring back people to work safely? We're all talking about that right now.
Mm-hmm.
What are kind of your suggestions there?
Well, the bottom line is, and the governor said this over and over, and I agree, that we have to listen to the scientists, the doctors, the healthcare professionals. And like he said, that he's, choosing between livelihood and people's lives. And it's very, very difficult. But I think that we need to follow, even though people haven't, but we need to follow, the philosophy behind the flattening of the curve, how many people, are still being admitted to the hospital. And what the governor has said he's looking at is, as he's opening, he's looking at what hospitals or what healthcare facilities are in that area, because if he opens and people get sick again, are these facilities going to be able to handle, what might come, like what happened in New York? But I know it's really tough. I mean, it affects all of us. Like my husband hates staying at home the way he has to stay at home, and he just itches to go out. So I'm living with someone that feels like a caged animal. But I think we have to follow the science and the recommendations, and hopefully that people, the restaurants that do have takeout, that people are supporting them and they're supporting the places that they can support, but I think that if we rush too soon, then, we'll be back to where we were, or maybe even worse. So we cannot do that either. We just have to make sure on the federal, state, county, city level that we support the businesses as much as we can.
And normally in a crisis like this, you'd kind of get people to work together. That would be your goal. Because we always have this battle between what's good for the community versus the individual.
Mm-hmm.
And particularly with the kind of shoddy leadership at the top, we think about these things. Most of them seem to be common sense. Most of them are being done by other countries. But you take almost any industry. I mentioned before the meat packing plants, and people crammed in there. A lot of times they made it voluntary if they wanted to wear masks. Look at the airlines. Some of the flights are empty and some are very crowded.
Mm-hmm.
And up until last week, nobody was requiring mask on people, on passengers. So there's so many things we're not doing. As we said before, it's partly because this country is not committed to helping the first responders or working families the way some others are. So again, that's a tough one.
And people have to look at that. You're your own best weapon in a way. So we have to be, make sure we social distance, wash our hands, and those kind of things. But yeah, I'm a respectful person and I work in a bipartisan way. But that guy, he's a shame. I mean, and thank goodness, I don't know how Dr. Fauci does it, but thank goodness he's there. We're concerned that at some point, because he has spoken up at different times, that he may not be there, as long as we want him there. But he's very respected, by so many doctors. I've had meetings with doctors from across the United States, and we've held so many different town halls. Town halls, I've held them individually or as part of a group. And people are very complimentary, of him, and but very concerned. I think that also, he's saying, open up, open up, open up, and we still have doctors saying that people don't get it, that you still need to social distance. You still, like what happened in Chicago, the group that the young people that had the house party, or in New York, the Hasidic Jews that had the funeral where all of them, were at. So we have to make sure we're picking the right messengers and getting the point across that, we still have to do what we can do, because the disease still can, or the virus still can affect more people.
And it absolutely will. Yeah, it's again, that collective action or community action versus individual is a tough one. And when you've got such shoddy leadership at the top, it doesn't inspire people. I'll do what I want. I don't care. By the way, Morgan, you can hear me. Just there may be other questions from people that are watching that I don't have. So feel free if you've got a couple.
Yeah, I actually have a good one from Patricia Graham, who wants to know if the Essential Workers Bill of Rights will be included in whole or in part in future COVID legislation.
We are working on CARES 2 now. Well, we've been working on it. And I'm not sure, let me ask my legislative director, Zach, if he knows the answer to that.
Okay, I'm unmuted. It's kind of unclear at this time. There's a lot of discussion ongoing, and a lot of different members are bringing different ideas to the table, and issues related to hazard pay or other, worker Bill of Rights measures, as well as issues related to the fact that the first of the month is later this week and rent is due, are a lot of really important issues which haven't been yet addressed. And those discussions are ongoing, both at the staff level and at the member level within the Democratic caucus. And just to kind of connect this to the earlier discussion of Senator McConnell with regard to funding for the municipalities, I think what's really going on here is Senator McConnell is trying to bring the bill further to his side, because he knows that the longer this crisis goes on, the more help people need. And the first couple of bills, the Senate kind of took the lead in the negotiations. And so the House is really, really well positioned with regard to these talks. And he's trying to draw it further to his side. So it's more important than ever that we take a really strong position and include really pro-worker, pro-consumer measures in this next package. And those are absolutely top of the list that are being discussed.
And also, and thank you for letting me see Zach. I haven't seen my legislative director for over a month.
Yeah, we do a lot of phone calls, not as much.
Yeah, a lot of phone calls. Yeah. He's on all my, conference calls. Also, the other thing is the Dem Caucus, we meet a couple times, we meet a lot, but a couple times a week, just the caucus, and have different speakers. So this Thursday we'll have different union heads that'll come, and I'm sure they'll be talking about that with us also. But we're bringing in different people to have discussions with us and share, their thoughts and knowledge. And then, like I said, we have a lot of us have our own individual meetings, so we get to hear from people, individuals from our area, what they're going through, what suggestions they have, and what's needed.
And you mentioned involving rent and mortgage support in that bill, and I'm wondering if you can talk a little bit more about that, because especially because it is something that's kind of too big a problem for a city to handle, and probably too big a problem for most states to handle. So it needs a federal response.
I can assure you, Congresswoman Maxine Waters is working very hard on this issue. There was some money given before to deal with low-income housing and homelessness, but we know that a lot more is needed. But we were just talking about this not too long ago. We just don't want people not to pay their rent, and then the landlord has to deal with it, because as we talk about, some landlords, that is their livelihood. So if they don't get paid, they can't pay. And some people, that's their retirement fund. So we're trying to help both. And, I know that the city of Chicago worked out a deal with realtors today, because that was part of Mayor Lightfoot's press conference, and they have a draft agreement or agreement that they signed that, renters wouldn't get kicked out. And Zach might have to jump in again, but that people are not going to get kicked out for not paying their rent, but also people have a little time, you know, to pay their mortgage also. But the issue we also have to work on is that, let's say when a certain amount of time is up, that all of that mortgage or everything is not due at once, because then people, you know, that'll be too difficult for most people, you know, or everybody I know, to pay everything in one lump sum. So we're trying to, you know, work that out and see what we can do and see how the federal government can help. But that is foremost on Maxine Water and the financial services on their minds. And that should be in this next bill.
Let me just again emphasize, because a lot of changes we need to make are obviously very political, that remember the states and cities, they have to have balanced budgets, unlike the federal government. And we're talking about massive numbers here. So any sane government is going to want everybody to come out okay, which means there's going to have to be some massive spending. And right now we seem like there's massive spending, but a lot of it's going to some of the people who don't need it. And there's still not enough money getting into the hands of people that are desperate every day. Fortunately, there's a lot of volunteerism, but that's not enough. So as we move forward, we have to figure out ways to deal with the inequalities. I saw Steve Saltzman had a question. I don't have it right here. Can you find it, Morgan, or did you have some others there?
Yeah, Steve, and if you want to just type that into the chat box, we can go ahead and ask that. And you know, for both the Congresswoman and for Zach, I'm curious, you know, we have obviously a lot of people who are very into the machinations of government participating tonight. And, you know, you mentioned that you hadn't seen Zach for a month. And obviously, you know, Congress, I think the Senate at least announced that they weren't, or the House announced that they weren't going to come back.
No,
yeah.
The Senate is though.
So how is it working? Like how are you having your meetings? Can you get things done virtually, or do you all have to be in the same room? You know.
I learned I'm not a stay-at-home work person. It's very difficult to be on the phone 8 hours a day, and you know, we're all in different time zones. So I work a lot with Karen Bass and Barbara Lee. So I'm, you know, 9:30 at night talking to them about things we're trying to, you know, accomplish, when I want to, you know, just shut the phone down. But we, like our staff, we have meetings 3 times a week, my personal staff, and then as necessary, you know, whoever I need to talk to, I talk to. And the Dem caucus, we meet 2 times a week for 2 hours, but that's the Dem caucus. We had our whip meeting today, and you know, Steny Hoyer might call a meeting. And then I also had an oversight meeting. That's the committee I'm on at ENC. So we have meetings every day. That's how we communicate. And of course, there's side meetings depending on what committee you're on or a subcommittee. The problem is, though, we can't vote remotely, and people don't agree with allowing that to happen, some members. So I don't know if that would pass, but what we're looking at is proxy voting. So those that feel comfortable flying in, they will have the proxy of someone else, but the someone else has to give the permission, and like I have to vote like they want me to vote. I can't vote for them, you know what I mean? Like, it can't be my opinion. So that's what we're trying to work out now. So we were gonna fly in, but they listened to the our Hill doctor, and he did not recommend it. Now on the Senate side, they feel that they're flying in because Mitch McConnell's trying to get some more judges, you know, under their wing. And I think Cory Booker said there might be 2 or 3 that they're trying to get passed this week. One's okay, the other 2 didn't sound okay, you know, so yeah. That's the deal with them. And but we'll fly back in to vote on CARES 2, and we'll fly back in, and hopefully it'll be the same time to talk about the proxy voting. But when we just flew in last week, we were very much separated. They had this, we were more than 6 feet apart. I was in the gallery sitting until it was my turn to come down. In my office, it was my chief and one other person. Everybody else was home. So that's how we have to, you know, operate. But it is difficult, you know, like when the Dems have their meeting, you get in the queue to ask a question, but there's 200 people, that want to ask questions. So you may not get a chance. So that part's frustrating. But Speaker Pelosi's been very open. You can call her, any other person in leadership. I mean, everybody's really trying and working really hard.
Do you find that the negotiating with either people in the caucus that don't agree or people in the Republican caucus is easier or harder when you can't actually sit and like face to face,
You know what? That's the thing. Like the hearings aren't really hearings. So I haven't really talked to that many Republicans. There's a certain group of people, like they hear from us and then they're the ones. And a lot of the talking is with Mnuchin. It's like the House is not dealing with McConnell so much. We know that the president wants to win again. So they're more amenable actually than it seems like McConnell is to some things because he wants the people's votes, so we try to use that leverage. But with McConnell, again, when he said the bankruptcy thing, there were a lot of Republicans that talked about him also. So that helped.
That gets into a little bit with Stephen's question.
Did you find Steve's question?
Yeah.
Good.
So it's about strategy. He's asking that, since the Trump administration decided that the loan money that's being given back by these giant companies can't be repurposed or redistributed, he's asking about the strategy of making that a key element in races in these vulnerable seats in the Senate in South Carolina, Kentucky, Maine, Colorado, Georgia, Arizona, and making it kind of a wedge issue, bringing it right to the people.
Well, I think that's what those candidates are doing. I mean, I believe Mark Kelly is going to beat McSally, and I think Susan Collins is going to lose, and the gentleman in Colorado. I mean, I think this helps us a lot. They're worried, definitely. That's why I don't understand McConnell and some of the comments, that he's making, but definitely those members are worried. We're hoping that Jamie Harris can beat Lindsey Graham. That would be a big one, if that can happen. But yeah, we are, believe me, they have given us, so much grist for the mill, just like his press conferences and things he's saying. But those Republicans were told not even to bring up Donald Trump or not to talk about him in any way, to distance themselves from him. So I'm sure you'll see commercials with them, like Susan Collins and Trump and McSally and Trump. So no, that will definitely be the strategy. And the thing is, it's so hard to even campaign now, so everything will be, social media or TV or radio, and actually in some ways, because we are doing, we're doing this, and we actually can deal with more people at one time because it is on the phone or people calling in, where if we had to go to everything, we couldn't, see as many people in one day.
Let me just take Steve's strategy a little step further. One of the things we always have to be doing, particularly when, in this case, the Treasury Department or Republicans are refusing to use that money for people that need it, take the dollar amounts, you can get all the dollar amounts, but then point out how you would spend it, okay? All these people, when people aren't getting the mass, they get $1,200, big deal. But you could actually do that, and you could show states how many people you could help with that money, and they won't do it. And I'm sure there's plenty of talented people around that could do the number crunch in there.
Right. Oh yeah. We walk a fine line because this is so serious, and we don't want to be accused of being political, which I know they'll do some of that anyway. And then we want bipartisan help. So we're walking a fine line of what our strategies are. But I'm sure as we get closer to November, that's going to go out the window, and we are going to do everything we can, because we cannot have that man again for 4 years. I mean, people around the world don't want to see him again, and we certainly don't want to see him. We dealt with these 3.5 years, but we cannot have him again. I mean, he's horrible.
Well, you may have a slightly different role to play, and you're a policy wonk, which is good. I think Steve's questions, and for a lot of our listeners here today, they're activists. And thinking of what can we be doing every day? That's a little harder. We don't have to lobby you for a lot of things. We don't have to lobby Danny Davis and Jan Schakowsky or whatever. But it's more challenging for us then. How do we move on these issues? How do we help? Critical time. How do we help for you all to negotiate more successfully on the next CARES Act so we get money where it really should go? Like, it's good that you got the hospital money, but the federal aid to cities and states is really big.
I know that has to come next.
Do we have time for any more, Morgan? I'm out of the questions because I can't see all that.
Yeah, I think we have time for one more. So let's take this one from Ray Sanders, which is about unemployment. The people that are applying for unemployment but are not getting it because of states like Florida, where the unemployment system was essentially purposely broken. Is there a federal level fix that we can be working towards?
You know, one issue I think there is, because of lack of leadership, it's so state by state by state, and different, not just in unemployment, but even in, you know, if you can get, go online to get for SNAP, or just, you know, some states have this and some states have that. I mean, if there's some way the feds can, I don't know if the Florida needs resources and money to fix their system. They have a Republican governor, so I don't know how quick. He's my former colleague, wants to rush and fix the system. You know, it was just so manipulative in, you know, some ways. That's a strategy, you know. So, I mean, he was slow to even close the state or believe, you know, what was going on. So, I mean, I'll think about that, and also bring that up to the Dem caucus. Like, what can we do? Financial services, what can we do if states are slow to help their people? I don't know if we could be slow in sending them money when we decide how much money, you know, states are getting, but then we don't want, you know, people to suffer, you know, in Florida. So that's hard to do that too.
No, we don't.
I don't know, Zach, do you have any ideas?
Yeah, no, it's a really interesting question, and not to get overly philosophical, but I think kind of that question is kind of a microcosm of this whole pandemic, illustrating some of the shortcomings of our federal system. You know, you see other countries that have like a wholly national government are able to have more of a centralized process in responding. The idea of withholding federal funds and playing that carrot and a stick, that's, you know, you don't want the innocent people to suffer, as the Congresswoman said, but there's, you know, I think some historical precedent to that. You know, the reason we have a national drinking age of 21 is because federal funds were withheld for highway construction to the states unless the state had a drinking age of 21. And so there's precedent there for saying, hey, your UI system has to meet these metrics or standards, otherwise you're not going to get funds. So that could be a way. But in the short term, I think the solution could be, you know, beefing up SSDI or additional direct payments to folks, you know, second, third, fourth, fifth, sixth stimulus checks directly to people as well. You know, because people need resources today, and it's unfortunate because of delays at the federal level getting the money to the states, and then delays at the state or municipal level getting money into people's pockets. So it's kind of an all hands on deck situation to get people funds as quickly as possible.
Right. And the bottom line is we know that we have to be electing better people, and we need to push those we've already elected, because there is an obvious difference. Right now, there's many millions of dollars going to very wealthy individuals, and there's millions of dollars not going to people that are desperate. So that's part of the future. Let me thank very much Congresswoman Robin Kelly, for being our guest, and Zach Ostrow, our Legislative Director. We appreciate it. For the rest of you, keep in mind that we'll probably be having a session, but a little more about housing, particularly in Chicago, and rents and mortgage and other things that are being worked on, affordable housing, homeless, et cetera. I still promise to bring back some folks talking about the budget, although that's kind of blown up, thinking of the city future, but all the local governments, major holes being blown there. And I think one of the questioners said, well, what can we do about it? So we'll be talking about that. And there's lots of other things, so I hope we get a chance to do it. So again, thank you, Robin.
Thank you.
Healthy. And everybody, thanks for all your questions. We'll try to respond to some of those. Some of those were off topic tonight because we tried to stick to this, but hopefully I could talk about some of those other things at a different time.
David, can you just remind people to fill out the census? Also, the city of Chicago, they're at 47%, so they're a little behind. The state is a little better, but that's so important. That's another way to get millions and millions and millions of dollars.
That's right. Millions of dollars, and otherwise we lose representation. So very critical. Census forms. Thank you, everyone. And I can't see all the faces. I wish I could, but it's good to see you all, even if it's from a distance. So
and yeah, so again, thank you to David. Thank you to Congresswoman Kelly and Zach for your time tonight. And tomorrow morning, all the participants here will be getting a survey about tonight's event in your email. We love getting feedback. It helps us make better events. So we appreciate hearing about what you thought of tonight's event, and we also want to gather some suggestions for future events, like David was talking about. And you can help us produce events like this by contributing to Good Government Illinois at www.goodgovernmentillinois.com. And again, make sure that you're on our email list and following us on social so that you'll be the first to hear about the next event that we do. Thank you so much, everybody, and have a great evening.